Hi, Dr. Ace Thayer here, Balance Focus Neck Adjustments. I'm here with Michael today, and Michael has been through the medical mill. He started with pain back in 1989, low back pain, vertigo, and headaches, and he has been shafted by the medical society, have just been torn apart by drugs, surgeries, useless surgeries that have only made him worse. He had a laminectomy, he had a fusion of his back, he had a pro disc put in, he had injections, he's been on every kind of drug possible, and he's here to get better. A chiropractor even turned him down from getting treated, so that really makes me sad about chiropractic profession. He's here in my office getting better. You guys are going to see that on camera. And watch the end, he gets actually choked up about having hope and that he feels better. So I hope you guys like this video. If you like it, like, subscribe, please watch it. Love you guys. See you guys next time. Hi, important video here today. Michael has come to us after years and years of back pain, vertigo, headaches. He's had problems for a number of years. He said it started back in 1989, kind of non-traumatic vertigo, headaches. It kind of just came out of spontaneous air and then just kind of got worse. Right. He's going to explain just what's going on, but his problem is that he's had these problems so long, and for me, the interesting thing is that he has only been through the medical mill, had a tiny bit of touch with chiropractic, a tiny bit of alternative medicine, but really has kind of avoided it and believed in the medical model all this time. And, you know, again, with the information out there, he did the best he could, but it has not served him well. Medicine has screwed him up. We're going to change him and get him as best we can with what we have, but it's taken a lot of years to get here. And so I can't wait for you to hear the story. Very important you guys learn that conservative is more important than going to the degree he has. But again, he's in the right spot. I'm going to take care of him. But I wish he would have come before the coursed But anyways, Michael, why are you here?
Started out, I had some headaches. And then couple more years later, I got vertigo pretty bad, where it got to the point where I couldn't ride in the back of a car or train or a plane or anything anymore.
And this is back in 1989 when it started, right?
Yeah, it took about maybe 92, something like that, for the vertigo to start happening. And then around 2000, I started having some problems with my back. And then
you had in between those 10 years before your back started going out, you were how are you treating your headaches and the vertigo?
I went to my primary care physician, and he tried to give me some medication, all kinds of medications. I tried them all. There was no result, though. I mean, I got some temporary relief, but not like solving the problem at all.
Gotcha. 2002 came. What happened then?
2002, my back got so bad that I wasn't even able to go to work.
How long were you out of work for?
I've been out of work since then.
Since 2002?
Yeah.
Okay. So at 2002, you started staying out of work and you went to the doctor, medical doctor.
Yeah, I went to the medical doctor.
And what did they do for you in the beginning?
At first, they just offered the same thing as my primary care physician, you know, aspirin, Motrin 800s, and then they started offering me muscle relaxers and other medications.
Okay, and so they did this conservative work on you, and then they ended up saying what to you after they took an MRI? They go, you know, Michael, you haven't worked in a while. We've done all the conservative stuff. You know, it looks like you have a 5mm disc in your back.
Yeah,
what should we do?
Yeah, they sent me to an orthopedic specialist, and he's the one that said you have a 5mm disc bulge in your back, and you should do surgery.
It's 2002, right?
Yeah.
Yeah.
2002.
And so you were out of work for a while, and you went through the conservative thing, and they go, let's do surgery.
Well, they tried 3 epidural injections, about approximately 1 month apart.
Zippo, yeah.
Yeah, didn't do anything.
Yeah.
They did a bunch of other tests. They did discography, nerve block, myelogram.
So
nothing.
So what was the promise with the surgery? What was the promise with the surgery? Let's have
pain
surgery.
relief.
Pain relief, and that maybe go back to work.
Oh,
right?
and go back to work. Yeah.
And so how many years ago was that? That was 16 years ago?
Yeah.
Yeah, and you haven't worked since?
Right.
Thank you, medicine. And so they also did something going forward, because that didn't help. They did a laminectomy, right?
A bilateral foraminotomy, just a big word that means they opened up both sides of the canal for the nerves.
Because it didn't work, because the first surgery didn't work.
Right.
So I have an idea. Screw up once, medicine, and let's bring some more screw up. Makes sense to me. Yeah, it makes sense to me. So how did that work? You've been back to work after this laminectomy, foraminal and opening stuff?
No.
Yeah. Okay, so then what happened? We go a little bit further out, and he's still in pain. And so what do they say then?
They wanted me to do another surgery.
Right away, almost, right?
Yeah, I waited 4 years.
No, but they wanted to do it right away. Why'd you wait 4 years though?
I didn't. I was looking for alternatives.
No, the European one.
Oh, that's right.
Yeah. He goes.
Germany
they wanted to do this. They wanted to do it right away, but he goes. This new sort of surgery from Germany was out there, and he wanted to wait. So tell us about that real quick.
Yeah, there's a new thing called Pro Disc. It's a flexible option for putting between the discs, and it wasn't available in the United States yet, so I wanted to wait for that.
Yeah, and so he seeked out some alternative medicine. What'd you do in that meantime?
In the meantime, I took medication. I went to physical therapy.
Yeah,
Not a whole lot more.
That's not alternative medicine. So, anyways, let's go to the chiropractic side. You had 2 chiropractic adjustments one time in the beginning with the medical doctor. Happened to have a chiropractor in his office. And what was your report from that?
I sat in a chair. He cracked my neck. Took about 30 seconds, and then I had some relief from the headaches. No relief at all from the vertigo.
That was 20 years ago, right? 25 years ago, maybe. And he still remembers to this day. He goes, I had 2 adjustments from the neck, and it kind of helped me a little bit. What about since then?
Nothing.
Nothing. I laugh because
I did go to one chiropractor in January.
This year?
Yeah. He took an X-ray. He looked at my X-ray and he saw the artificial disc and the other fusion, and he said, "I'm sorry, I can't touch you. I got to get permission from an orthopedic surgeon before I can work on you."
So again, I bag on medicine, but I'm also bagging on this chiropractor. A chiropractor, you could have helped him. I don't know what the hell. You think you're going to send him back to the medical model? He's going to get better? Give me a break. You need to check yourself as a chiropractor and go, you know something? He is in your office because he's been failed by medicine. He should have some kind of relief. You should at least do something to help him. Something. We love these kind of patients here because they're difficult, and we're going to have him show you on camera, have him change, and have him understand that he can get his life back with chiropractic, not with medicine. So let's just go over a couple of the symptoms. He has terrible sleep, sinus congestion, wakes up all the frickin' time at night.
Yeah, 10 to 12 times a night I wake up.
Constipation all the frickin' time for years. Anxiety, depression over the years. Again, has been to frickin' how many ENTs?
I've been to 4 in the last 3 years.
Okay, neurologists, tons of neurologists.
I've been to 4 in the last 3 years.
Yeah, orthopedic surgeons, medical doctors, all this fucking crap. And he's here because he's at his wit's end. How'd you find us?
YouTube.
YouTube. Anything else you want to add?
Yeah, I watched 2 episodes of YouTube and said, that's where I need
I know.
to be.
And the best part about this, guys, the best part about this is that I have people out there, and you guys know who you are, that have been waiting 6 months, a year before they're like even going to pull the trigger.
Don't wait.
This guy, he doesn't even know yet, but this guy is, I'm going to say, scared of chiropractic, scared of this alternative medicine thing, because you can see by the way he's reacted over the years. He watches 2 of my videos and makes an appointment.
Yeah, the light went on.
He drew a direct correlation between whatever this fucker's doing, I'm going.
Yeah, I saw where it was helping. And
so he is so crazy for this pain. He typed this whole thing out, has tons of information for me, brought in his old x-rays. You guys let you see a precursor to how bad his surgery is. Can you see that on camera? Yeah. The original cage, here's the Pro Disc right here. Here's the other side of it. This is 2009 when this is taken. I'll show you the other video. I'll show you the x-rays later. They look pretty much the same. Arthritis hasn't really attacked him very much. His neck is really messed up, but I'll show you guys those in the future. Ready to check it out? Ready to get going?
Yeah.
Good. Over here. So, Michael, we're going to look at the range of motions like we talked about a few minutes ago. Just be as honest as you can. Do not embellish. Just go with what you feel, okay?
Okay.
Bend over, touch your toes as best you can. Pain in your back, sir?
That's a 9.
9 out of 10. Go ahead and go back.
That's an 8 out of 10.
And tell us where the pain is exactly. Right at your
Lower
disc?
back, yeah.
Right at the disc area?
Yes.
All right, look at the floor with your neck. How about that?
That's a 6. A 5.
Okay, tell us about your headache. How bad is your headache right now?
My headache's about a 6 right now.
And your vertigo, your light.
My vertigo's about a 6 also.
6 also. And
And
then
that's constant.
And that's constant, right? And so you're going to do one more thing. He's been working on this for years. He says 3 years. Is balance. Go ahead and stand up your toes. Try to stand there for about 10 seconds. And you say this is better than it used to be, right?
Yeah.
Gotcha. But
I
how?
still can't do it long, but I.
Keep it up a little bit longer. Keep it longer, a little longer. You guys can see how he's moving around. And this is working on for 3 stinking years. You ready, dude?
Yeah.
Let's do it. On your back over here. Okay, fingers in your belly like this. Good. By the way, look at this guy. 50 frickin' 2. Look at how young he looks. Not doing too bad, dude. Body's falling apart, but at least you look young. Okay, so most important thing, you haven't adjusted your neck. You haven't adjusted your neck in 25 years. So just relax best you can. I'm not gonna shoot for a home run. We're just gonna get a nice conservative adjustment. Okay.
Okay.
Good. Good. You're doing fine right here. Good. Fearful, I know, I can feel that, but any other first impressions here?
That side feels like it relaxed a little bit.
Okay. Anything else off the top of your head? Or is that about it?
I feel kind of like a rush of dizziness.
Okay, cool. Ready for one more? No. That looks like a no.
Yeah, okay.
Yeah, one more, okay?
All right.
Trust me, this is going to be okay, okay?
Yeah.
This is what you guys get when you wait till the last second, when you've built up this many years of anxiety on getting adjusted. It's scary. Let this go there. Good, nice. Okay, not so bad on that side, huh?
Yeah, that was a little better.
A little better. Okay, any other first impressions real quick before we get you up?
No.
No? Okay. Relax, chin up. Right there. Good. Relax, relax, relax. Okay, so in a moment you're going to get up. When you get up, no twisting or turning. The more you twist and turn, the more you're going to undo my work, okay?
Okay.
You're just going to look straight ahead, keep your arms at your side.
All right.
Just sit on the table right there. Okay. Breathe in your nose. Relax. Okay, first impression now.
I feel a little bit dizzy.
Good. Anything else?
Yeah, it's starting to circulate down to
You
my
know-
lower back and into my legs a little bit.
You
now.
kind of feel
Kind
like
of
all over both
feel
stuff.
something settling maybe.
Good. Okay, we're going to walk in a second. That walking is going to help recalibrate your spine. I mean, it's going to spread that neck adjustment through your whole body. Most important thing, don't try to manipulate yourself. Don't try to move yourself in any certain way. Just walk. Look straight ahead. Keep your arms at your side. Walk in front door, please.
Still a little dizzy.
Yeah, I can see that. Okay, relax shoulders. Breathe in the nose. Keep going.
Okay.
One more lap. In the nose. You can't expect to erase 20 years of
It's starting to feel better now.
all your issues in one moment, but you're going to feel different. Stand right here. I know the dizziness is still there a little bit, right?
Yeah.
We're just going to find out what you feel like right now, just overall, and then we're going to go through the range of motions. Just first impressions again.
Feels pretty extreme. I got a
Extreme?
lot of
Cool.
yeah. I got a lot
things
of
going on.
things going on. Yeah. I'm kind of dizzy, shaking. Not sure.
If you guys-
I do feel like some of the tension's been released
Yeah.
around the.
And the interesting thing, you don't feel this maybe, or maybe you do, but you got so much stuff going on. But I can see you're not shaking as much. If you stood next to him, you can't see this in camera, but before he shakes, it's like his whole body's shaking. He's much more still, and so that's a good sign right here.
Yeah, the body seems more still. My arms are shaking a little bit, but the body does seem
It
more
does look a
still.
little bit less. Okay, so let's go through this range of motion and see how you're doing. Okay, then over touch toes. Wait, see how much further it went, guys? That was a
That's-
9.
Yeah, that's more like a 6 now.
Okay, are you serious?
Yeah, it's more like a 6.
Okay, did I touch your back?
No.
Yeah.
It
Interesting.
feels, instead of pulling on the back now, it feels like it's on the hamstrings.
Where it's
Yeah.
supposed to be, by the way.
Oh, okay.
Go ahead and go back.
Yeah, that's like a 5 now.
Yeah, kind of cool so far, huh?
Yeah, so far good.
Yeah.
Real good.
So you take all the medication, do you get 40% pain relief in what, 3 minutes? Usually when you take those things.
No. And they never last at
And they
all.
never last, right? Okay, look at the floor, please. That was a 6, I think you said.
Yeah, it's like 4 maybe.
Okay, just truth and go. See anything?
Oh, that one's better. That's like a 3.
Like a 3?
Yeah.
Gotcha. So it's cool so far, right?
Yeah, real cool.
Okay, so let's talk about your headache.
The headache is like a 2 now. Not even that, maybe a 1.
Okay, so these people don't believe you out there.
I feel like I got tension released out of my jaw too. Like it just opened it all up.
How about the vertigo? You were a 6 before, 6 or 7. right?
I'm a little dizzy still
That's
from
fine.
the
That's fine. I
adjustment.
just want to know if
but
there's any difference there. If there's none, fine. But I'm just curious if there's anything. I'm just asking
I
full
feel
gamut.
something, but I can't be sure right now.
Fair enough. I just want the truth. Okay.
Right.
Let's stand up on your toes. 10 seconds. I can see you moving, but I want to know what you feel. Do you feel like you have more balance, more control of it? You feel it's the same?
It's close to the same,
Okay, fair enough. Fair enough. Okay.
but that's because I still feel a little dizzy from the adjustment.
Exactly. This is going to get better. If I could, I'd let you walk on the video more and do all this stuff that would recalibrate your spine more, but I want to keep it short and sweet in this video. I'm going to do follow-up for you. What do you think of this first? Do you feel some hope? What do you feel after this first adjustment? I'm curious, because this is first real chiropractic intervention you've had in the whole time.
I feel a lot of hope. I feel like this is probably my last chance. It's been a lot of years. It's been a tough road.
It has, huh? I'm glad you're here. I'm really
Yeah, me
glad
too.
you're here. I'm really glad you're here.
Thank you, sir.
Yes. This is not the end. This is just the beginning.
Any improvement's amazing for me. Thank you.
See you guys.